Can a resident with symptoms of a viral respiratory infection remain in the shared room with a roommate?
Yeah, so we say when available, residents should be placed in single person rooms to minimize the risk of transmission to roommates. But moving residents to a single room is often not practical because, for example, there's limited availability. And so in those situations, residents can remain in their room, in their current location, but with additional steps taken to try to limit transmission in the room. And so I know I mentioned earlier the use of in-room HEPA filters or HEPA air cleaners to increase ventilation, and then separating the resident beds as far as possible from one another, and then using a curtain and pulling that curtain in between those residents. Symptomatic residents should not be placed in a room with a new roommate unless they've both been confirmed to have the same respiratory infection. That ill resident should remain in their room, and if they have to leave the room, ideally should wear a mask if they are able to tolerate doing so. And then, as I said earlier, roommates of that symptomatic resident who have already been potentially exposed and could become infected should not be placed with new roommates. They should be considered exposed and wear a face mask for source control around others.